She trembles in the waiting room, gloved hands clasped so tightly her knuckles have gone white beneath the fabric. The gas lamps flicker overhead, casting shadows that dance across mahogany walls lined with leather-bound medical journals she has never been permitted to read. Adelaide Whitmore has been here 3 times this month, and each visit carries the same suffocating weight of shame she cannot name. The insomnia came first, then the irritability that made her snap at servants over nothing. Her hands shake during afternoon tea, her chest tightens until breathing feels like drowning on dry land. 3 weeks ago at a social function, something broke inside her, a violent, convulsive sensation that left her gasping and flushed, forcing her husband to escort her out in dignified silence while whispers followed them like ghosts. She consulted 2 physicians before Dr. Carter. Both prescribed rest and bitter tinctures that left her mind foggy and her symptoms unchanged. But Dr. Carter is different, younger, modern, the kind of physician who reads German medical journals and speaks with absolute certainty about the nature of women's afflictions. When she enters his office, he doesn't waste time on pleasantries. He listens as she describes her symptoms, his pen scratching against paper, occasionally nodding with grim recognition. Then he pronounces the verdict that hangs in the air like a death sentence. Hysteria, a common condition in women of your station, he explains, his voice carrying the weight of medical authority. The female nervous system is delicate, far more susceptible to disturbance than the male constitution. The uterus exercises a profound influence over the entire female system, and when left unsatisfied, when its essential functions are thwarted, it becomes restless. This restlessness manifests as precisely the symptoms you describe. Adelaide feels heat rush to her face at the word unsatisfied. She's a respectable married woman. Surely he doesn't mean what she thinks he means. But he's already gesturing toward a screen in the corner, instructing her to disrobe and lie on the examination table. The condition responds quite well to proper intervention, he assures her, particularly when caught early. Behind the screen, her heart hammers against her ribs as she removes her layers of clothing. When she emerges wrapped in a simple white sheet, Dr. Carter has arranged his instruments on a small tray. A bottle of oil that smells of lavender and roses, clean cloths, and an expression of professional concentration utterly devoid of anything improper. The examination table is leather and cold, despite the summer heat. She lies back, her upper body covered, only the area below her waist exposed. Dr. Carter positions himself between her legs and begins to apply the scented oil with measured, deliberate movements. At first it feels clinical, medicinal, but then his fingers begin to move with greater purpose, rubbing in circular motions, pressing deeper, finding sensitive points she didn't know existed. She wants to speak, to object, but no words come. He hasn't asked permission for any of this. He simply proceeds as though this were any standard medical examination, as routine as checking her pulse or examining her throat. If you're fascinated by the darkness lurking in history's most respected institutions, if there's something compelling about how brilliantly wrong educated people can be, hit that subscribe button and ring the notification bell. I genuinely want to know where you're listening from. Which parts of the world find this particular brand of medical catastrophe most unsettling? Comment below and tell me your location, because what happens next reveals how an entire profession spent 2 centuries giving women orgasms while maintaining a completely straight face about it. His movements quicken. The sensation building within her is unlike anything she's experienced, alarming and overwhelming in equal measure. Her breathing becomes shallow, her muscles contract involuntarily, and then comes a sudden violent release. Her back arches off the table, her hands grasp the edges, and for a moment everything dissolves into sensation, into an explosion of pressure and relief, and something so foreign to her lived experience that she couldn't name it if her life depended on it. When it's over, she lies gasping, her skin flushed, her entire body trembling with something that feels dangerously close to pleasure. Dr. Carter steps back, already writing notes on his clipboard as though he'd merely checked her reflexes. Excellent, he says almost to himself. The paroxysm was quite pronounced. You should see immediate relief from your symptoms. I'd like to see you again next Thursday. Twice weekly for the next month would be optimal. She dresses in silence, her mind reeling, unable to process what just happened, and yet she feels the strangest compulsion to comply, to return next Thursday to submit to this treatment again. Because Dr. Carter is a physician, and physicians don't do anything improper, do they? The concept didn't emerge from Victorian prudishness. It rose from something far older and far more insidious. Long before Dr. Carter's clinic existed, the ancient world had already decided what was fundamentally wrong with women. Hippocrates, the man Western medicine reveres as its father, looked at women suffering from anxiety and nervous complaints and came to a simple conclusion. Their internal organs were literally traveling through their bodies. The Greeks called it hysteria, the wandering womb. Hippocrates theorized that when a woman remained unwed, when her womb received no regular attention from a man, the organ would grow restless, detach from its moorings, and wander through her body cavity like a lost animal seeking what it had been denied. As it moved, it would press against other organs, trap nerves, disturb blood flow, cause a cascade of symptoms that seemed to strike randomly across the female body. This wasn't cruelty disguised as medicine. It was logic as ironclad as geometry to the ancient mind. Women's bodies had a purpose, and if that purpose went unfulfilled, of course something would go wrong. By the Renaissance, physicians had begun dissecting female cadavers and discovered the uterus didn't actually move around the body. It was anchored in place by ligaments and structures. There was no mechanism by which it could travel. But here's where history takes its turn toward the truly absurd. They kept the diagnosis anyway. If it wasn't a wandering womb causing the problem, it was something else. Something about the female reproductive system's inherent instability. The symptoms remained vague enough to encompass almost anything: nervousness, insomnia, muscle spasms, shortness of breath, loss of appetite, irritability, sexual frigidity. Combined paradoxically with sexual forwardness, a woman could be hysterical for showing too much sexual interest or too little, for being too emotional or too cold. The condition was infinitely elastic, capable of absorbing any behavior that didn't align with the narrow parameters of what a respectable woman should be. By the Victorian era, hysteria had become the catch-all diagnosis for female discontent, and physicians estimated it affected 1/4 of all women. 1/4, that's not a disease. That's most of the female experience being pathologized. The treatment scale became staggering. By the late 19th century, physicians estimated that 75% of American women suffered from hysteria. 3 out of every 4 women, diagnosed with a disease, treated regularly, often weekly for years. In major cities, certain physicians specialized exclusively in hysteria treatment and became wealthy doing it. Their waiting rooms were full, appointment books packed months in advance. Some women appear in these records for years, every Thursday at 2 o'clock. Same time, same treatment, week after week stretching into decades. The treatment wasn't limited to physicians' offices either. Wealthy women could arrange house calls, and the most fashionable option was the hydrotherapy resort's specialized clinics throughout Europe that advertised water-based hysteria treatments involving powerful jets of pressurized water directed at the patient's genitals while she sat on specially designed chairs. These weren't marginal facilities. They were luxury destinations where women would travel from across Europe to spend weeks receiving multiple treatments daily. Dr. Russell Troll, writing in 1903, complained extensively about the treatment's demanding nature. Achieving hysterical paroxysm could require up to an hour and a half of continuous manipulation, making it among the most tedious and exhausting of medical procedures. He wrote, "The physical demand placed upon the physician is considerable." Read that again. A trained physician complaining about how physically tiring it is to manually stimulate women to orgasm. And he had absolutely no idea that's what he was complaining about. He genuinely believed he was performing a medical duty like setting broken bones. It was simply exhausting work. Victorian physicians could read clinical descriptions of muscle contractions, flushing, rapid respiration, vaginal lubrication, and not recognize it as orgasm because the medical education they received had essentially erased female sexuality from existence. Medical textbooks showed detailed anatomical drawings of male reproductive anatomy but treated the female version with remarkable vagueness. The clitoris was barely mentioned, if at all, labeled as a vestigial organ, essentially useless, its function unclear. Some texts omitted it entirely. Physicians received their entire medical education without ever learning that this small structure was a center of sexual sensitivity. They literally didn't know it existed in any functionally meaningful way. What makes this historical horror so profound isn't just the treatment itself, it's the psychological architecture that made it possible. Every element was designed to maintain the illusion: examination rooms with high ceilings to prevent intimacy, detailed medical charts on the walls to keep the focus, clinical screens that allowed physicians to approach from angles minimizing eye contact, and perhaps most telling of all, the practice of covering the patient's face during treatment so both physician and patient could pretend this was unhappening. The mechanism of denial was built into the procedure itself. For decades, possibly centuries, millions of women received orgasms from their physicians while an entire medical establishment maintained a collective delusion that female sexuality simply didn't exist. They documented every physical response, recorded every symptom of sexual frustration, treated the condition with methodical precision, and remained completely blind to what they were actually doing. It's a testament to how powerfully cultural beliefs can override observable reality, how respectability and professional authority can construct elaborate fantasies more comforting than truth. I want to know what you're thinking right now. Does this make you angry, disturbed? Comment below and share your reaction, because this story isn't just about medical history, it's about how societies construct elaborate systems to avoid seeing what's right in front of them. And that's a horror that didn't end with the Victorians.